I think we're live.
Welcome everyone.
Hey guys, it's Katie here from Equestrian Movement. We are doing our last presentation for our first Do No Harm Summit. Hooray! I hope you guys have enjoyed it as much as I have. It's been such a oh my God, weekend, all of the things that we've learned, all of the presentations that we've watched. I've got so many big ahas and takeaways. And I think it's just been wonderful to watch so many people who have dedicated their life to pursuing this knowledge with the dedication and the passion that they have. I can't believe that we've been able to get so many amazing people together to share their knowledge and hopefully help you make decisions that help you to be the best person you can for your horse. As a trainer and instructor, I really appreciate, the effort that these ladies have put into becoming the people that they are. A lot of the topics that they taught on are actually things that I had to learn to be a trainer and instructor, and all of the myths they busted were what we get taught. So me as an instructor will be going out and teaching you guys all of these things that are actually incorrect. So this is why we need people who are so dedicated and so passionate about finding the answers and, really digging in and resolving these issues so that we can move forward with accurate teachings. So I just can't thank our presenters enough for gifting us their time, their passion and their knowledge, and also you guys that have been sitting through the hours of presentations and and interacting with us the way that you have and giving feedback on what you're learning. It has been pretty amazing. Mind blown. And I'd say Sarah is about to just contribute that last extra mind-blowing factor with all of her vet nurse terminology that I am not going to be able to keep my head around. So Sarah's going to be presenting her topic tonight, and I absolutely love the title, Worm Your Way Into Your Horse's Heart, where she has, worming is such a tricky topic. I have gotten to the point where I just don't even teach or recommend on it anymore. I just say talk to your vet, because there's so many opinions and different things that get passed around that it's so easy to just be passing on misinformation and misteachings and contributing to the issues that we are seeing with worm burdens in our horses rather than actually supporting our horses and their worm burdens. So let's get ready to bust some more myths.
As Katie said, tonight I'm going to be talking about the intestinal worming process with our horse. So I'm actually going to focus not just on what worms are around and a little bit about when to manage them, but I'm also going to talk about how, as in let's address some of those people that are struggling to actually worm their horse, which is a massive big thing. So if my pointer is on, I can move forward. Yay!
Hey, you and technology is amazing.
I'm a tech expert. So who am I? Well, I am absolutely 100% a crazy animal lover. I was the person at the age of 5 who turned around and said that I was going to be a vet, and that answer didn't change the entire time I was growing up until I started working in the veterinary industry, in which case I said, no, I'm definitely not being a vet. I'm going to be a vet nurse. But I do have a Bachelor of Applied Science in Animal Studies, so I do have a fairly scientific grasp on a lot of the animal sciences that are out there. I have worked for many, many years as a veterinary nurse, as a veterinary tech, as a practice manager in veterinary clinics, and now I actually work supporting vets with regards to nutritional topics in dogs and cats. That's my normal day job. On my side, I'm working with Katie as the co-founder of Equestrian Movement, working to be a horse. So I like to refer to myself as a horse trainer in training, which Katie sometimes disagrees with, but then sometimes does agree with. So we'll see which one, depending which one I am on the day. Besides being a crazy animal lover and a crazy cat lover, yes, I am one of those people who loves felines. I am absolutely 100% obsessed with horses. It was something that I grew up with. I was one of those kids. I did not play with Barbie dolls. I played with toy horses. I cantered in the schoolyard. I pretended I was a horse. I had an imaginary horse that used to follow me around all the time. And I was just one of those kids that was never actually lucky enough to own her own horse growing up. So when I was lucky enough to meet a friend of mine who, you know, on a in a veterinary clinic, it was just one random conversation where she mentioned ponies, and I said, "You like pony? You have ponies?" And she goes, "Yes." "So you like ponies?" And I said, "Yes." And so begun a wonderful friendship where she's actually allowing me to lease and play with her horses. That was the first time that I actually really got to start playing with horses, and that was about 6 years ago, and that was playing with them full time. I'm now what I would call the proud parent of Custard, who's a quarter horse cross Percheron. He is 26 and literally we have just retired him from riding just because of age. He just can't cope with my weight on his back anymore, and that's a-okay because we still get to play, and we've done amazing work with him, bringing him from the rescue horse that he essentially was to what he is now, which is a loving creature that fondly refers to me as the crazy cookie lady, I'm sure. What I am not, and I'm going to preface this with today, I am not a veterinarian. So any of the information that you do hear from me, if you have questions about it, I would strongly recommend that we can definitely ask your questions 100%, pop them in chat, leave it in the comments in Facebook. But there are going to be times when I'm going to send you back to your veterinarian, because your veterinarian is going to know what is best. The other thing to bear in mind is that I'm also Australian. For those of you who aren't in Australia, if you couldn't guess from my accent, hello, I'm an Aussie. And there's a lot of things that can be different country to country. So, you know, particularly if you are outside of Australia, just make sure that you do reference some of this with your own veterinarian or your own insight that you do know. So let's just have a little bit of a chat about these following processes. So we're going to first of all talk about the horseworm and the wormers that are available. Then I will talk to what we refer to as best practice, and you'll understand why I use quotation marks around best practice soon. And then we'll finally hit on the deworming process, so the actual doing the worming. And I'm sure that some of you right now are probably cringing in horror, wondering how we can actually make this better for our horses. So let's talk about our horseworms. There are many different varieties of worms, and there are different varieties of wormers. There's different brands of wormers, which we will touch on what you can be using for different types of worms. But the big thing is that our horseworms, our gastrointestinal worms, some of them are actually life-threatening, and some of them can be a-okay, as in the horse develops a little bit of an immune response or a tolerance to them rather than immune response, where they can cope with a small burden or even a slightly heavier burden. But then some, even in smaller quantities, can be quite life-threatening depending on the age, the you know, immune system, and also just the worm itself. But I first of all want to touch on our dewormers. And the dewormers, I'm actually going to talk specifically about the active ingredients, predominantly because if I reference brands that I know, they could be completely different in another country. And a world-class example of this, and it drives me absolutely nuts when I say this, and sorry, this is slightly off topic, but in the US, there's a product called Benadryl, which is purely an antihistamine. And on occasion, vets have recommended using it, or I'm assuming vets have recommended using Benadryl in dogs that have hives. However, in Australia, Benadryl is not an antihistamine, or not purely an antihistamine, and it does actually contain an active ingredient which could be toxic to your dog. So I get really, really frustrated when people start responding to people, like people post something about their dog having an allergy, and people go, oh, just use Benadryl. That person's in the US, doesn't know any better because that's what their vet has told them. But unfortunately, when it comes across to Australia, people are going, oh, we'll just use Benadryl. They give a dose to their dog, and their dog ends up in hospital with a very expensive medical bill. So I won't actually specifically talk to brands, but I will actually talk more on the active ingredients. And there are 4 main classes of wormers, and they are grouped in active ingredients. So the first one is what we call macrocyclic lactones. So they're your ivermectin types. So ivermectin, abamectin, moxidectin, these are the guys that you would normally see. And the giveaway is they end in ectin, E-C-T-I-N. So if you're looking on your worming paste, I'm assuming everybody knows where the active ingredients are, but in case you don't know, it's usually written underneath the brand name, and you'll see these complex words that are usually followed with a number and a milligram or microgram or something like that. So that's what you're looking for. If it ends in ectin, E-C-T-I-N, it's a macrocyclic lactone. There's also the benzimidazoles. Benzimidazole. I'm not going to be able to say it. Benbendazoles, oxyfendazoles, oxbendazoles. These are the type of ones we're talking about. And if they end in azole, these are the types of drug class that it is. And Katie, you were worried about you not being able to say it. Now I can't even say it now. Benzimidazole. There it is. There's also ones called pyrantel. They're the tetrahydropyrimidines. Now I'm saying them really slow because I'm worried I'm going to get tongue-dried. We don't see a lot of pyrantels solely. They're usually combined with either one of the bendazoles or one of the mectins. But they are often, so they can be used as well. And then there's another active ingredient called praziquantel, and praziquantel is only used for tapeworm. If you have dogs and cats, praziquantel is also used in dog and cat wormers as well, just as an FYI. So let's talk about some of our fun worms. So we'll start off with our bots. Now, when it comes to bots, the bot worms actually come from botflies, and there are 2 different types of botflies or bot eggs that are laid, or bot larvae, I should say. The first one, the botfly lays the egg on the leg, and then the horse will lick its leg, and 5 days after licking, the larva emerges from that egg, around about 5 days. The horse continues licking the leg, particularly because there's more botflies that are sort of harassing it. It's a little bit irritated. The larvae then is on the tongue and goes into the mucosal tissue, and then can also be swallowed. The second type of botfly actually lays the eggs around the throat region. So I don't know if you've seen those. They tend to be just on the upper neck and around the throat underneath the chin. They're actually a little bit nastier in that the larvae don't require the horse to lick. They just hatch, and then they actually burrow through the skin into the mucosal lining and will sit there, and you can actually see ulcerations in the mouth because of these types of worm larvae before they finally hatch out, get swallowed, and go into the gut. And if you saw on the previous slide, the top picture, that is actually our bots up here. So the things that they cause: inflammation of the mouth, irritation to the stomach, ulceration of the stomach. They can be responsible for colic in some cases. And you can also get skin irritations from the burrowing bots that I talked about that get hatched on the neck. Bots are only impacted by the mectins, and predominantly ivermectin. I believe there were some stories about moxidectin just not working as effectively, so ivermectin is the drug of choice with these guys. There's also small strangles. Actually, just let me double check. I think I've skipped ahead, haven't I? Nope, I haven't. Never mind. So there's small strangles. These guys are also known as small redworm in some areas. They, in my notes, I literally wrote clever little bastards. They can actually slow down their migration to the large intestine. So when there's enough of the small strangles in the large intestine, they actually send a signal to the rest of the larvae and say, hey, slow down your progress. Stay there. There's enough of us here producing enough eggs. We're fine. You just rest for a while. And once that signal stops, the larvae continue that migration to the large intestine. So these small strangles can stay in cyst for quite some time and hibernate in the intestinal wall if there is already enough of a worm burden inside of the colon itself. What that means is when they're in cyst, they create this scarring around the intestinal tract. And the scarring is partly an immune response and partly due to the fact that they've burrowed there. And the immune system just creates this kind of barrier, which is temporary because the worms can continue burrowing through. But what that scarring can do is actually lead to malabsorption issues where you end up with nutrients not being able to be absorbed as well because the gastrointestinal tract doesn't have as many of the polyps and surfaces to actually absorb these nutrients. So you get what we refer to as a little bit of a feed inefficiency. So you can sometimes see these in horses that are chronic underperformers. Sometimes you'll start to see a lack of condition and a decrease in the immune system as the body is forcing itself to try and get rid of these strangles as well. They tend to be killed by some of the fenbendazoles and moxidectins, but I'll talk a little bit more about resistance later because there's some reports about resistance in them. The other thing to note is that the encysted strangles will only ever be impacted by moxidectin. So while the larvae is in the encysted section stage, they just won't be impacted by anything else. And then there's the large strangles. These ones are the nastiest of the nastiest. Once they get to the large intestine, they actually migrate into the blood vessels and sit at the head of the major blood vessels for the colon region. And they're literally feeding on the artery and vessel wall, the blood vessel wall. So what can happen is you can get this weakening of the vessel wall, which can create, develop into aneurysms, so small bleeds or stretches of the vessels so that it's much more fragile. They can break off in a clump together, go further down that blood vessel and then create a full-on obstruction in that blood vessel, which creates what we call a thromboembolic colic. So it's literally a colic induced by a stroke because the blood can no longer supply the colon. They can also cause blood clots, and they can rupture that main intestinal artery, which is obviously quite life-threatening for a horse in that particular case. So large strangles are never something that you ever want to be dealing with. The great thing is that they're actually quite sensitive to a lot of the bendazoles and ivermectin as well. So quite easy to get rid of as long as we manage them well. Roundworms or ascarids, they are fairly okay. Horses develop sort of a tolerance to these as they age. So by the time they're sort of 2, 3, they don't seem to be as impacted as much. But even though they might have this tolerance to them, that sort of tolerance doesn't actually prevent the migration of those worms and the damage that the parasites can cause to the intestinal tract. The fun thing is that the roundworm eggs, they're actually triple coated and not susceptible to weather, which means they can actually exist in the environment for up to 10 years, which means that regular worming is really, really important. They can migrate through the intestinal tract into the liver and then through the lungs. The liver can cope fairly well with that because the liver has got regenerative properties, but the lungs don't really do that well. So we often see our younger horses getting much more impacted by these guys as their immune system is developing and much more reactive in that as well. It's really important to note that, unfortunately, fecal testing, fecal worm egg tests don't actually capture these guys in migration phase. It only captures the egg phase as it's shedding. So and that's where it's in the intestinal wall. So once it's migrated through to the liver and into the lungs, we don't know that they actually have them. Pinworms aren't really, and now roundworms, they're impacted by the bendizomoles and moxidectin. So again, very similar to a lot of the other worms in there. Pinworms tend to not cause much of a problem in our horses. More than anything, it's an irritation. Yeah, and we often see those worms actually on the anus region. So where you might see roundworms actually in the feces, these smaller pinworms, which look fairly similar, but they're much thinner and they're much smaller, will tend to be literally crawling out of the backside. So you'll start to see that anal irritation and tail itching and that rubbing of the bum, and sometimes you'll actually see the worms. They're actually quite easy to get rid of at this stage, so thank goodness. Then we have threadworms. These guys are much more of an issue with our younger horses, particularly our foals, and they're actually quite unique in the way that they're passed. So with regards to majority of the worms, they actually have to be orally ingested. So like even the botworm, which lays the eggs on the throat and the larvae migrate through to the mouth, they still have to be swallowed to continue through their life stage. Threadworms, on the other hand, yes, they can be orally picked up. They can also pass through the mare's udder or milk into the foal. And there's also some insects that do carry them, and they can actually be injected via the skin. So you might see the terminology of neck threadworm, where you see kind of this hair loss and irritation and itching and swelling, where the horses are like overreacting to the location, to the presence of the worm in the subcutaneous region. It's a much bigger problem with our foals, which means that it can create blood loss and anemia, diarrhea, and can be quite life-threatening. But once they become adults, they tend to be a lot more tolerant of it, and you can sometimes see those skin lesions and that loss of hair, as I mentioned. They tend to be sensitive to your ivermectins and oxybenzole. And then there's tapeworms. Once upon a time, tapeworms were actually considered quite harmless, but there's now actually a lot of research going into it, and they're considered to be a bit more insidious of certain diseases, including things like sudden colic and poor condition. Sometimes, though, it can go completely undetected, and the drama with tapeworms is they're not similar to any of the other worms in that when they shed their eggs are actually in egg sacs. So they're very hard to actually detect. So rather than having eggs that are just floating straight out into the feces, which can be detected by fecal worm egg counts, these sacs don't do very well. Even if you manage to catch some of those egg sacs, they don't actually float well in the fecal egg count, like the fecal float material, the fluid that we use. So it makes it even harder for us to detect them, even if they are present in the fecal sample. And another thing is that a lot of veterinary practices aren't equipped with the requirements to do these particular tests. So in most of our cases, the diagnosis can actually get missed. You might see visibly tapeworm specimens in the feces. They look, it's going to sound quite odd, a little bit like mini ravioli on the poo, like really tiny little squarish or rectangular-ish pockets. And you usually see that after they've been treated with a drug that's active against it. And the only drugs are praziquantel, and they can also, Priorantal has some effect against it as well. So, but praziquantel is the one that we tend to use most frequently. Before I go on, there is another worm that I did want to mention, but I'm not going to go into it too much tonight. There is a worm called lungworms. These tend to be much more prevalent in paddocks that are housed with donkeys. So donkeys can actually tolerate these worms really, really well. Horses, on the other hand, don't. And the worm itself, lungworm, it causes persistent coughing in horses as respiratory issues develop. So if you have horses with donkeys and one of your horses is coughing, I would be concerned about lungworm. If you don't, I would probably not be too worried about it, but I would just ask your vet with regards to any support.
Just before you go on there, Sarah, Robin asked if there is a botfly that enters through the nose.
There are different botflies out there. There's actually, I don't know if there's a larva that enters through the nose specifically. I know that the horse ones can enter through mucosal tissue and track down. So you might find that some of that larvae can actually go in through the nasal tissue and then track down into the oral cavity and then be swallowed. I do know of a botfly which naturally hosts on, or parasites on rabbits in the US, which what they do is they actually lay their eggs around the burrow hole of the rabbit. So as the rabbit enters the burrow, the eggs are brushed over the rabbit, and then the larvae hatch and they create skin lesions. They actually burrow into the skin and live under the skin layer. And the reason I know that is because there were some very interesting videos that came up recently in some horse groups, and I had to do a lot more research to understand it, about cats that had these massive botworms in their skull, like on the skin under their skull. And if you're a bit of a medical geek like me, it was kind of like, I'm one of those people that actually kind of likes Dr. Pimple Popper stuff. So I was partly fascinated by the extraction of this worm and horrified at the poor discomfort that the cat was experiencing. So yeah, I was in two minds of it, whereas with people, I'm just like, yeah, just get that pimple out, that's fine. So yeah, there's lots of different bots and lots of different ways that they potentially could, but I don't know of every single one. So yeah, Robin, it could be that there's one that sort of works around that nasal cavity, but it also could be that botfly that tends to lay eggs on the chin that is probably going to have that larvae migrate subcutaneously to the oral cavity, and it may do it in the nose.
Melanie asked if with botflies we should be worming for these when we see the bot eggs on our horses, or only when we see signs of infection. I think you're going to talk about that later, aren't you?
I am actually, yes. So I'll address that a little bit later, hopefully.
And both Robin and Alison are never eating ravioli again.
You're welcome, guys. You will find that in the veterinary industry, we have a very unusual sense of humour. This is so that we can cope with emptying anal gland, or talking about anal glands and abscesses while we're eating. and also to cope with the general things that we do see on a semi-regular basis, which can be sort of traumatic with us. So we do have a slightly warped sense of humour. So I apologise if I make anybody sick. If I'm going a bit too graphic, please do let me know and I'll try to rein it back in. My husband often has to remind me that I need to stop talking about my day over dinner because I get so excited about what I'm talking about and I forget that he's just like trying to hold down a vomit. All right, so let's, now that we know a little bit more about the worms themselves, I'm going to talk about what we refer to as best practice. And the very first thing that I am going to tell you is that no singular management is appropriate for every single horse. So it's quite possible that you were taught years ago, like I was, that every horse needs to be wormed every 6 to 12 weeks. This might be true in some cases, but the majority of our equine population probably shouldn't be wormed this frequently. It's actually more important that we ascertain if they need the worming as opposed to just worming them out. And a large reason for that is the resistance, which I'll actually talk about. So they say foals should be drenched from about 6 weeks of age. Every 4 weeks until 6 months of age. Pregnant mares should be treated just before foaling. Then when it comes to other horses, it could be that horses require as little as twice, as often as every 6 to 8 weeks or as little as twice a year. And it depends on the individual circumstances. Our very young and our very old horses may need more frequent deworming because their immune system just isn't as tolerant and their bodies aren't as tolerant as well. Horses that are housed in herds, in larger herds, may require more frequent deworming than those in smaller groups or those that are solitary. When we are looking at things like introducing a new horse into our herd, we should probably consider what's happening in the worming cycle. And while I'm not saying that you immediately worm every horse that comes into your paddock, we should be thinking about, you know, is it worth investigating whether or not they do have a worm burden? Should we do some isolation or quarantine period before we introduce them to the herd as well? The other things that you do need to consider as well is the parasite life cycle. So, and this is where the botfly comes in, Melanie. So adult botflies actually tend to die off on that very first frost. So in Queensland, we have probably just started to experience that. So our botflies are starting, that botfly cycle is just starting to kill off, as in the adult botflies are dying. And this is when we would worm them. Whereas our tapeworm is usually recommended worming against about once a year. And it's somewhere around that August, September, usually. However, you can do it more frequently where evidence is present. So, you know, tapeworm-related colic, evidence of the tapeworm segments in the feces. So hopefully that has answered your question, Melanie. All right. So let's talk a little bit about resistance. And this is actually quite a major concern for the industry. It is a major concern because there are only 4 known tolerated groups of chemicals that actually interact with, like, kill these worms, but also are safe for use in horses. And we spoke about them first up in the presentation. That's it. That's all we have. So if any worms become totally resistant to all 4 of those, we are screwed. And that's why it's a bit of a concern. So in scientific studies, and believe you me, checking those very thoroughly to ensure that they're actually credible studies was quite in-depth study for me in preparation for this, because I like to be very thorough. But it has been noted in several studies, scientific studies in the UK, in the US and in Australia in different levels. So there's some references that roundworm can be resistant to ivermectin in some herds. So not totally, but in some cases. There's also reports of the small Strangles being resistant to our fembendazoles and parentals coming from the UK. So it becomes much more important to start thinking about why our worms are developing resistance. And part of the reason why our worms are developing resistance is because they're, oh, I thought I had another slide on that. I probably do. Yeah, never mind. um, is predominantly because we are doing some very fun things such as underdosing. So they're getting a taste of the drug, but they're not actually getting enough to kill them, so they can actually develop a tolerance to it. This is going to, again, wacky vet humor coming out. Not that any vet has actually ever done this, but it's kind of like feeding a poison to your partner so that they develop in small doses, or yourself, so you develop a bit more of a tolerance to it, so that if you actually come across it. I think that's more seen in those spy movies more than anything else, but yes, we do talk about fun things like that. That is one of the reasons we do over frequently dosing, dosing for the wrong things. So using benbendazoles when they aren't sensitive to it is actually going to help them build a resistance to it as well. Those are the types of reasons our resistance start to occur. So I wanted to just give you some potential examples of what a worming cycle could look like for your horse, or worming program could look like for your horse. There's a couple of key things that we do talk about with regards to it helping avoid resistance. The first, and I've probably put my slides in the wrong way, which is why I thought I've moved my slide back. So I might actually go ahead to it before I talk about the worming worming program examples. So in terms of reducing resistance, we do talk a little bit about the use of fecal worm egg counts, and it is something that I would recommend in quite a lot of cases. Not in every single case, but at least at some point, and I'll talk a little bit more about that later. We definitely have to avoid underdosing, and the way we need to do that is to make sure that we're dosing for the correct weight of our horse. So if you guys aren't sure of how to calculate the weight of your horse, I think you can usually get some pretty good weight tapes from your local produce store, or you can talk to a veterinarian about getting them. Dosing too frequently as well is actually going to increase some of that resistance if we don't dose appropriately. We do need to consider the rotation of our active ingredients or the class of wormer, and we need to target specific worms that with an effective product at the correct time of the year. So there's no point in worming for a wormer for botflies in spring if that's what you're actually targeting. If you're using the ivermectin for botflies for a different worm, that's not necessarily a bad thing, but be mindful that there's other worms there that might not be as sensitive to ivermectin and start developing more of a resistance to it. So a couple of examples that I threw together, and these are completely 100% made up. So these are not actual real life examples, but just potentially what you can be considering to do, and what the pattern looks like. So in example A, we're going to have a 12-year-old thoroughbred that's healthy. There's low susceptibility to the worm burden, and that's been checked through fecal worm egg counts. This horse rarely goes outside of its paddock, and it's a solitary horse as well. So what we would do here is in that springtime, we are worming for our, let's see if this works. Whee! I hope you can see my red dot. In the springtime, we're worming for our tapewormer, as well as all other worms except for bots. But in our autumn, we might use the oxfenadazole against our bots. Year 2, we're doing a slightly different one where we're not using moxidectin at all. We are using oxfenadazole again. We're still using praziquantel because that is the best one from a tapeworm perspective. There's only one drug that I know in Australia for horses with pyrantel in it, so it's not frequently used. And then in autumn, again, we're just doing a straight up ivermectin type wormer. Example B is a little bit more complex. So we have more horses in the paddock this time, and 2 of them are much more susceptible in terms of their immune system has decreased significantly. So we're talking about horses over the age of 25. The other 6 horses in the paddock are used in pony club. They're all what would be classed as low shedders. And again, that's something that's looked at from a fecal worm egg count. So in this particular example, we'd actually separate our senior horses from our adult horses and treat them slightly differently. And you would do this also when you see, when you do fecal worm egg counts, you can actually identify who are what we call super shedders or super spreaders of the worm eggs quite easily, because you know, they might be in a herd where everybody else is shedding low quantities, but those, even though they're a healthy adult, they're shedding a whole lot more. And they would be what we would call a high risk and require more dosing. So in this particular one, you would cycle over a different year the different active ingredients, and you might consider increasing the dosing for our senior horses to 4, 6, 12 times. Well, probably not 12 times, that's probably going a bit nuts, but maybe 4 to 6 times a year using this type of cycle. And then with our adult horses, we might test in the winter and summertime instead to see what sort of worm burden they have. So those are just 2 examples. And looking at it, I may have got my drug mixed up in that, but that's okay, because they're literally just examples of what you might do as opposed to the actual product that you could use. I wanted to pull this up because this actually came from the Virbac website. So Virbac is a company that I know is based in Australia that does a lot of horse worming products and a lot of horse drugs, a lot of animal drugs actually. And they have a recommendation on their website as to what to use. But even on their own recommendation, they actually say this is just a guideline, refer to your veterinarian for best practice, pretty much. But what they are saying is that maybe every 2 months, so every 8 weeks, you're maybe looking at that, and you may be looking at testing and only treating worm shedders during the winter and summer months, and then looking at things like tapeworms and other worms through there. But I do like it because it does actually focus on some of the targeted parasites. So it's certainly worth having a bit of a read of what they're recommending to target. But of course, what I would say again is that it's an Australian company on an Australian website, so it's probably may not be fully relevant for everybody else that's not in Australia. So let's talk about our fecal worm egg counts. So huge confusion in the veterinary industry. When I was working on this presentation and I started having doubts about what I was talking about, I decided to give a few of my vet colleagues a call. And do you think I could get one single answer that was exactly the same? No, not one. But what we do know with regards to fecal worm egg counts is that it may help reduce resistance. When you are doing fecal worm egg counts though, it is pointless just doing one. It seriously is. If you are going to use them, you need to use them up to 7 days prior to dosing the wormer, and then follow it up with a 14-day test as well. And the reason we do that is because if you don't have a starting point, how do you know if the worm has worked? So whether you can identify that worm resistance, and how do you know how much they were shedding to start with? Again, whether or not it's actually worked. So if you do it but just before, all you're going to be getting out of that is what worm eggs are potentially there. And again, remembering that some of our worms are actually not visible on a fecal worm egg count. So botworms are not visible on a fecal worm egg count. Tapeworm is not, and our assisted Strangles is not. So if we only do that fecal worm egg count, the best you're going to get is a rough idea of what worms to target and what active ingredient to get, which can definitely help in reducing some of that level of resistance. However, if you do that test beforehand and you don't do one afterwards, how do you know whether or not it's worked, or whether the worms that you're dealing with have some level of resistance and you need to use another active ingredient? So it's a when it comes to fecal worm egg counts, I am definitely in favour of doing them. I am not one that personally thinks you need to do them for every single worming cycle. particularly if you have only 1 or 2 horses in your paddock. However, if you are introducing a lot of new horses, if your horse is traveling quite a lot, if your horse is at higher risk of diseases because they have ages or complexities with medical management or those types of things, I would probably definitely look at doing fecal worm egg counts a little bit more frequently. All I would suggest though is speak with your vet. As I said, some vets have said it's almost completely pointless. And what I would say with those vets is that they're mostly dealing with people who have 1 or 2 horses on their paddock. Others are like, we only recommend worming only when there's a fecal worm egg count done. And they're probably ones that deal with a lot more breeding stock or showing stock or things like that. In actual fact, yes, that was the case when I was speaking to them. So you'll get varying opinions from your vets even in the same region, but talk to them about it and talk to them about your concerns as well. The other thing to be mindful of is that unfortunately a negative test is not proof that you don't have any worms. As I said, there's the limitation with regards to certain worms, but also it's kind of like an average sample. So sometimes you might want to get more samples just to confirm that if you are getting negative tests. And then if it is truly negative after like 2, maybe 3, yay, no worming needed. When it comes to deworming practices as well.
Yeah, interrupt you for a sec, Sarah.
Sure.
Joanne has just said that the last statement is interesting. At their barn, a horse was scoped to look for ulcers as she'd colicked twice in a month. She had a large bot infestation in her stomach, but her fecal worm count tested negative.
Yep, because bots don't show up in a fecal worm egg count test. So you can't rely completely on the fecal worm egg test. Knowing that bots, tapeworms and encysted strangles don't turn up, you need to be worming for those. And that's why we talk about worming at least twice a year. So bots we're talking about after the first frost in autumn, because that kills the adults, so there's no more eggs being laid. So scrape off it's usually about 7 days after the first frost, I should say. You scrape off the eggs, by then they've usually hatched anyway, and you dose them out and bang, you've got rid of those worms, and you won't see them for the rest of the season till next year when botflies are start active again because someone else didn't worm. And then tapewormers are much more common in the August, September, or is it September, October, somewhere around that period. So springtime is usually when we start to look at doing your tapeworms. And your encysted strangles, they're sensitive to moxidectin, which if you dose them with that once or twice a year, because usually your other ones have some moxidectin or ivermectin in them, you're probably going to get rid of them as well. So any other questions that have popped up before I continue on? Cool.
No, that's good.
Our other deworming tips. We really need to make sure that we have really good pasture management. So pasture management also, we're talking about picking up poo twice a week. We're talking about the grazing fields, trying to keep the pasture length at less than 8 inches. The reason for that is that that allows any of the eggs that are exposed from the manure breakdown to be exposed to sunlight, and that will actually kill them off faster, except for the roundworm ones, which will live there for 10 years regardless. Tricky little buggers. Raking manure to expose worm eggs will also help with that as well. The other cool thing is you can consider, if you have the opportunity, cross-grazing pasture with other species like cows and sheep. They are literally like little worm mowers. There's very few worms that the cows and the horses, that cows and sheep carry that cross over to horses, but they do vacuum them up from the ground, those worm eggs from the ground, to actually clear it out from our horse stock. And because they are much more tolerant and much more resistant to them, or they don't impact them at all, we're actually eliminating them full stop. And another big thing is to avoid the overcrowding of our paddocks as well. The more crowded our paddocks are, the less grazing pasture is, the more likely they are to be grazing around manure, the more likely they are to be picking up those worms.
Joanne asked if horses can pick up worms from goats or chickens.
I would have to double check on goats for you, Joanne, but chickens should be fine. I don't think there's a single birdworm that crosses across into horses.
It's good to know. Ducks and whatnot as well share the paddock.
Yeah, there might be other parasites that, like protozoas, that can sometimes impact multiple species. We're usually thinking the more common ones I'm thinking of, although I don't think they really impact birds either, are Giardia and Coccidiosis. But we don't usually treat a lot of horses for Giardia and Coccidiosis because they're quite fussy creatures. They'd have to be pretty sick to be, or in pretty poor management to be picking up those types of parasites usually, as well. Okay, so we are going to crack into the favourite part, and I am so sorry I didn't realise this was going to go for so long, considering it's only 20 slides. So this is, I guess, the part that probably fills most of us with dread. It's the actual doing the worming, and there's a few things that I want to run you through. So, but I thought the best way to do it was to give you an example and quiz you on it. So be prepared with your answer buzzers. So person X collects their horse from the paddock. They walk the horse up to the prep area, pick up the worming paste. Person X actually has had issues with worming their horse in the past or medicating their horse in the past, so they're actually already starting to feel a little bit nervous about this process. Holding the halter, person X pushes the syringe into the mouth of the horse, squirts the paste. Horse's head immediately goes up and the horse backs away, but that's okay because the worming paste got in there. So person X pulls away the syringe, walks the horse back out to the paddock and lets them go. So what went wrong in this scenario? Is it A, nothing, because the horse is wormed? Woohoo! B, the person got nervous and made her horse feel nervous. C, the horse learnt that head up means scary thing goes away. Or D, the horse was let out immediately after the session. So which do you think it would be? So I'll give you guys some time to think about it. Now, just thinking about the scenario, she collected her horse from and I shouldn't say her, X collected X's horse from the paddock, brought it out, feeling a little bit nervous about the worming, shoved the worming, placed the worming syringe, I shouldn't say shoved, that's a very rude word, placed the worming syringe into the mouth, squirted, the horse's head went up, backed away, but it's okay because it was successful. The horse actually got wormed, pulled the syringe away, took the horse back out and let him go. So let's see what responses we get. Who thinks what went wrong?
So Melanie says B, C, and D. Joanne says C. Robin says lack of person Y to capture it on YouTube.
I love it. And it is actually B and C, and possibly to some degree D. There is nothing wrong with worming your horse and turning it straight out. But in that scenario, the horse won a particular battle and the session finished, so it learnt that when I do this, this thing stops, and that's the key thing. So our approach in the deworming process is a big part of it, and how our horses learn is the next big part of it. So let's talk about what the process looks like from a horse. So first of all, the horse is caught, it's halted, it's taken away from the field. It needs to stand at the person's shoulder. And while standing at a shoulder, it actually has to tolerate a hand on the halter, a hand on the face, finger in the mouth, right? The next thing, it still has to continue standing still with a syringe raised, touching its face with a finger in the mouth, syringe in the mouth, squirting the paste. And then it has to swallow the paste. That is what our horses have to face every time we worm them. Or I'm also going to throw it out there, medicate them with a medical paste. Now, how many of these areas do you think can go wrong? every single one of them. And if they're not standing still at your shoulder, you've got backly chance of them standing still while they've got a syringe in their mouth. If they're not comfortable to stand still with your hand on their halter, so if they're not going to stand with your hand on their halter, you've got Buckley's chance of helping them stand still next to you with their hand on their shoulder while you're bringing a paste tube up to their face, putting it inside their mouth and squirting this weird tasting thing on their tongue. And here's the kicker. These are all other things that can impact it: your approach, your response, your emotions, the external environment that's happening, and your horse's own personality at the time. All of them play another part in this process. So what we need to be thinking about, if your horse is not behaving, and I use the term behave, because as far as the horse is concerned, he's behaving just fine. If he gets away with what he wants by no longer having a syringe in his mouth, he's behaved in the appropriate response to stop the unpleasant thing happening to him. And let's have a look at this picture of this horse. What do you think this horse's, if we look back at the areas where it can go wrong, what do you think this horse is trying to say? This horse doesn't like that syringe. His head is already starting to raise up, his ears are back, he's feeling a bit threatened, his eyes are on the syringe. He is worried about that syringe. So what I would suggest doing for that particular horse is starting to look at doing some targeting or touch to make sure that the scary thing isn't scary anymore, and that they become a lot more curious and investigative about what we're bringing to their face. And I would take this quite slowly. And so I would say identify where your breakdown in the process is. You need to use things like pressure and release to get your horse to seek the correct response. Work on a positive relationship to reduce impacting in your bond. And if you really struggle with your horse during worming time, do this when he's not due for worming. Don't try to do it last minute, because you're going to rush, be anxious, feeling anxious that you actually have to do it because it's the time of the year that you need to dose them out, and he's not ready for it. These processes that I'm talking about, they're actually included in our training trainability program. There are.
Before we move on, Robin has asked if we can give the poor horse an apple or carrot to munch on afterwards. I just want to put my own 2 cents in here. Sometimes the horse will use that apple or carrot to spit the worming paste out.
And sometimes they don't want to either. So we have to be mindful of that treating process during this process, so that they don't waste your wormer, spit it out, slobber it all over your face or chest or shirt or whatever. But 2, they also might not be ready to receive it. So we don't want to make our positive reinforcements, like some of our treats, looked on less favorably. We want them to still have some level of happiness about that. So you might dose them, let them process it, let them swallow it, go and do some other activities, maybe like our favorite activity, walk, stop, back, and then give him a treat, so that he doesn't associate the treat with the negative taste of the wormer. Cheats. I'm never against cheating if I know that I'm going to put the work in properly later. And there's big reasons for that. Now, there is a pretty cool tool floating around. If you search for it on the internet, it's things called like Wormabit. And I honestly can't remember the other one that I came across, but it's got a similar name. And it's literally a plastic bit that has straps on it that you put around the back of the pole of the horse. And the plastic bit is hollow with a couple of little holes into it, so that you put the syringe in, you depress the plunger of the syringe, it fills the wormer bit, and then you literally use another plunger to put all of that paste in from the bit into the mouth. So it's potentially a tool that can be used. There's a couple of problems that I do see with it though. One, it can actually potentially create a problem with bit acceptance later. If your horse's pure negativity is around the taste or feel of that paste in their mouth, if we don't take the time to train them and we use a type of tool like this, we can actually create negative associations to other things that we want to do, such as riding them, because they don't like the bit. And so they just don't want anything going in their mouth at all. The other thing is, I didn't realize it when I first looked at it, but it's actually plastic. And I'm never a big fan of something that is plastic going into an animal's mouth, because if it's not fitted, if it's not placed correctly, and who's going to take the time to make sure it's completely fitted correctly, really, the horse could actually mouth on it, crack it, and then create more dramas. There's also worming pellets. So with our worming pellets, I've got nothing against worming pellets, apart from they can taste a little bit bitter. As far as I'm aware, I could only find ones that are mectin based. So you're only going to get your Ivermectin or your Ivermectin or moxidectin sensitive worms. So it's not going to get a whole class of them. And it's completely 100% dependent on the horse eating the entire dose. Now, that's not a huge amount, but if your horse has a tendency to leave things in the bottom of the barrel, wander away because it doesn't like licking, then you're potentially not getting that full dose, which of course is a risk of underdosing, which increases the risk of resistance. A lot of our worming pellets also aren't recommended for our younger horses under the age of 1 or 2. So just be aware of that as well. Hiding wormers in treats. This is where you can sometimes get that negative association with a positive reward. As I said, I'm not necessarily against it if it means that, you know, if it's something that you can do in an emergency where you really need to give them something and you need to dose it straight away. But it's not ideal for regular dosing of medications in particular. And it's 100% dependent on the taste of the wormer, and also the volume of wormer that you actually have to dose. Because if you think about it, some of the amounts of wormers that we have to give is quite large. You've been given a lot of treats to hide that wormer, and you pretty much want to dose it in a short period of time. So you don't want to dose it over like 2 or 3 days. Otherwise you are underdosing. Now, worming tubes filled with yummy stuff. I actually love this, because this is what I would recommend using for the horse that is actually quite concerned of the worming tube, and particularly the taste of the paste. In this particular process, you could use something like molasses or applesauce in a clean, previously used worming tube. You would use that worming tube to do a little bit of that desensitization and curiosity building. And then once it goes in and you start to squirt, what you're doing by putting yummy stuff in there instead of the wormer is you're getting them used to the feel of something being squirted on their tongue, which is invasive. If you've ever had somebody walk up to you and stick a syringe in their mouth and squirt something into it, I'm betting you haven't. But it's quite rude. Let's be honest, it's kind of rude. Somebody shoves something in your mouth and squirts it. But it can just create some of that level of acceptance as you're helping to train them through this worming process. So,
just as an additional note there, most of our horses, the only time they see a worming tube is when we go to worm them. So,
or medicate them.
Or medicate. I don't know how clever they are with telling the difference between syringes and worming tubes, but anytime they see a syringe or a worming tube, it never tastes good. Yeah.
So, and that's why I reckon it's a great tool for a little bit of desensitization, and can help with that curiosity building. It would be great if we could somewhat teach our horses to put the worming tube in their own mouth, but I also am not sure I would be recommending them trying to mouth things teaching them how to mouth things, just because they'll probably mouth a lot of wrong things trying to get the right thing done. So, but definitely from a desensitization process, these types of, like, that one is a good one to trial.
Some horses are perfect with it as well. It just depends on the horse.
Yeah, and look, you know, I would also say some horses are perfect until they're not, and you have the case in point right now.
He's still perfect about being syringed and drenched in worms. One thing he does tolerate. And needled. He loves, like, he stands up perfectly to be needled. I'm like, you're such a weirdo.
Yeah. And I think that's the thing, you know, we can have a horse that is perfect for quite some time for one thing that we are doing, but then they'll be a point where they just reach a level of tolerance that they can't tolerate it anymore. And, you know, sometimes that will happen when our horses become unwell and they're starting to feel better, but we still have to continue medicating them. So they'll start to create a negative association to the entire process. And that's why, like, stepping back, having a look at what the process is of the worming or medicating, and then identifying where the breakdown happens for your horse and going back to that level and bringing them along the journey. And that is really what we are focusing on in the training trainability course. Like that, while we don't have worming as a specific example in there yet, that is the whole idea of the exercises and the training that we do inside that, is to be able to take those levels of those concepts and apply it to different scenarios for your horse as they come up. So looking at things like getting your horse to seek connection, building that trust, creating that confidence. Now, if we think about from a worming perspective, the trust, the connection has to come for the catching them and haltering them and bringing them in. The trust is going to be standing there at your shoulder, standing still while you're touching their face. The confidence is going to be their approach and your their approach and reaction, and your approach with regards to the worming tube. And your horse needs to have a way to be able to say, can't deal with this right now. I mean, we also have to be mindful that sometimes they have to deal with it and we have to do it. But, you know, if we allow our horses to think about things for a little bit longer, perhaps there's, you know, like 3 horses that are galloping down the back end paddock and your horse is like, oh my God, what's going on over there? And you're just about to put the syringe of worming paste in his mouth, and that's not where he's focusing. It's not where he's confident. He's wondering what the hell's going on. And suddenly he's got this thing in his mouth, he's overreacted, he's backed up, he's thrown his head in the air. You've moved away because you can't keep the syringe near his face anymore, or he's started to get a little bit spooky and you've gotten a bit nervous. That's where the breakdown for that process comes in, and that's where the horse learns that if I just do those reactions, I don't get that yucky thing in my mouth anymore. So we need to be able to do that, and opening our pathways of communication is really the first step in all of these processes when we are looking at things like the deworming. And what it's going to do as well is create that willingness instead of submissiveness. So I did want to let you guys know that the training trainability course is now open for enrollment until May the 6th. It's got the step-by-step foundational exercises that we can help you tailor to your own horse, lesson plans that can help you put more of these skills in practice, plus the group coaching sessions. But I have committed with Katie that by the end of June in 2020, we will actually have the How to Approach Worming the Difficult Horse section for you, which will include a video demonstration of what you can do. We will try to find some of those that are a little bit less happy about doing that, but I can't promise that. But we'll see how we go and at least talk through what we would do if our horse was reacting in a way that might be scary or might be difficult to manage.
I should be able to find one.
Pardon?
I should be able to find one.
We should be able to spend all day working with him, right? And also as a bonus, Katie's thrown in 2 free personal video coaching sessions as well, which are valued at $170. For the trainability course, it's only $45 a month. So it is like less than half the price, or just about half the price of one of Katie's sessions when you would train with her normally. So you can actually access that until May 6th at just $45 a month. So it's a pretty cool offer. And it's got the 14-day guarantee. So if you go in and check it out, you don't like what we've got to offer, that's okay. Just contact us and we will refund your money. So in summary, worms are dangerous. Sometimes they're insidious, as someone mentioned. You know, they did the fecal worm egg count test, and then found out that the horse was full of bots anyway after scoping. And they can actually kill. They can. Like, this is why it's so important for us to actually have a regime that works for our horses. No single strategy is or single wormer works for every single horse. You need to make sure that you tailor it to your own particular horse, and the factors that I talked about earlier, such as that age and susceptibility, whether or not they're super shedders, how many horses are in your paddock, what the paddock situation is actually like, how frequently horses are moving in and off the property. They will all impact the way you need to do your worming management. We should be practicing resistance avoidance at every step. So thinking about rotation. And yes, that does mean you might need to invest in some form of app or calendar for your horse if you don't have one already. Don't solely rely on your cheap methods to escape the difficult to dose horse, because you can create more problems elsewhere. Do work on that worming process and consider the areas of training you might actually need to do to support your horse throughout it. Any questions?
We've covered a lot of them as we were going, so maybe give it a couple minutes in case somebody wants a question, but I think otherwise we're good.
Woo. So yeah, so hopefully that's giving you guys a bit of insight. I would have loved to have come out and said that this is the strategy that works for every single horse, every single time, and this is exactly what you must be doing. But alas, it's not that. It's never going to be that. You need to make those choices for your horse, for your individual environments. And you need to work with your veterinarians, because you may find that certain areas have a higher risk factor to certain worms as well. Just because of history of prevalence, particularly roundworms, which stay in the environment for up to 10 years. So do consider those.
I think if we have learned anything this weekend, it's one size fits all never works.
It's the first do no harm method. Let's look at our horses as individual personalities, not as the same beast everywhere.
No questions, just lots of hoorays. Hooray!
So this is us at the end of the summit, which has been an absolute massive event. I know that even though I've sat here and been a part, even in the background of every single presentation, I still feel like I'm going to have to sit down and go back and listen to them all over again. Which is why, if you are in the Facebook group, they are in the First Do No Harm Units section, so you can go back and watch them to your heart's content. If you are joining us from our webinar, and thank you, Arlene and Sarah, I can see that you are both joined in this evening's session. If you prefer not to join by Facebook, that's a-okay, because we will send the recording links out to you, and the recording links will be up for the next 2 weeks. So you'll have access to watch them over the next coming 2 weeks. Possibly longer if I forget to turn off the websites, the web pages. But it has been absolutely massive, and we've learnt so much. So definitely want to say a massive thank you. I know Katie said this at the start, but a massive thank you to our other presenters. So Lisa Marie at Full Stride Solutions, Anna from the Bitfitter, Lisa at the Glorious Hoof, Jane at Evoke Aromatics, Lindsay, the Savvy Horsewoman, Elise from Stoker's Ridge Ranch, Zane from at Physio Zane, and Christine from Equine Muscle Matters. Now, I want you guys to know that these guys put their time in for free to give you this information. So the goal was to make sure that we walked away leaving you guys with some sort of information, something that might help you out in the future. So if you think you can go ahead and support them or follow them or learn more from them, absolutely make sure you do. Their links have been posted on the website. Their links have been posted in their in their video feeds as well. So pop on over and make sure you do support them if you think you can continue learning something extra from them. Otherwise, if you didn't, that's okay, because you got something out of it anyway. But a massive, huge thank you to these guys again. You know, it was time out of their weekend, time doing the preparations, preparing for the presentations. It was absolutely amazing to have them come on board from all across the globe. So thank you, and a big thank you to Katie for helping me host it and doing 2 of the presentations, even though we were supposed to share one of them.
I should also say that, you know, these ladies that presented over the weekend are ladies that we truly respect their opinions, and a lot of them are my go-to professionals because I don't know everything. And if you've learned anything from listening to them over the weekend, is that when you focus on one particular area, you just gain so much knowledge and experience, because you know that's where your focus and your dedication is, and we can't all have that kind of knowledge, so we need to have trusted practitioners that we can go to for this extra support. So I really wholeheartedly recommend that you follow what they're sharing on their socials and their websites as well, because obviously this is just the tip of the iceberg, you know. This is just them sharing a little bit about themselves and some case studies. If you really are looking to implement some of these strategies, then you really it will get so much out of listening to what they have to share as well.
Absolutely. But you know what time it is now, Katie?
Party!
Party!
Time for the tequilas.
Oh, so thank you guys again so much. Hang around in the group if you like what we're putting down. If you don't, that's okay. We'll forgive you for leaving. It's absolutely fine. Some people don't like how cookie we are. That's okay. Thank you so much. We'll see you guys next. Are we doing training Thursday this week, Katie?
Oh, I guess so. Let's give me a week off.
Next week. It might be next week.
Yeah, we should give everybody some time to rewatch.
Yeah. Let's give you guys a chance to binge and rewatch, because I'm sure that there's about 11 hours worth of content, maybe closer to 12 hours worth of content to binge and rewatch. So we will see you guys in the Facebook group, and we will see you in Thursday week with the next Training Thursday. Thank you.
Bye.
Stop.